Hello everyone, hope you all are doing good. Welcome back. Today we are going to study about dental anatomy. Dental anatomy is a study of the development, morphology, function and identity of each tooth in the human dentition. There are two jaws in the oral cavity. Upper jaw is called as maxilla and lower jaw is called as mandible. Coming to the formation of dentition, there are two sets in the human dentition. First is called as primary or deciduous dentition. It begins prenatally at about 14 weeks in utero and completes postnatally at about 3 years. After this, the second set is called as permanent or succedaneous dentition. It begins at the age of 6 years and completes at the age of 12 years. Next, formula for human teeth. Formula for primary dentition is 2102. For this, we divide the jaw into two halves from the midline. The first two teeth from the midline are called incisors. The first tooth from the midline is called as central incisor and the second tooth after central incisor is called as lateral incisor. The third tooth from the midline next to the lateral incisor is called as canine. It is usually sharp and single. The last two teeth after the canine are called molars. First is called first molar and second one is the second molar. Formula for permanent dentition is 2123. The only difference between the primary and permanent dentition is the presence of two extra teeth after the canine and before the first molar, that are premolars. First being the first premolar and second being the second premolar. Okay. Next, coming to the tooth numbering system. There are three tooth numbering systems. First being the universal system. For this system, we divide the entire dentition into four quadrants, naming as 1, 2, 3 and 4. Numbering starts from the upper right corner till the upper left corner. When the row completes, the numbering reverses in the lower quadrants, that is from the lower left corner till the lower right corner. Point to remember here is alphabets are used to denote the primary dentition and numbers are used to denote the permanent dentition. Now, trick to remember the universal system is write the first alphabet, that is U, in a horizontal direction and follow the arrow as shown in the figure. Okay. Now, coming to the next system, that is Zsigmondy-Palmer notation system. For this also the trick is the first alphabet, write it and follow the arrows. In this system, the tooth numbering starts from the center and ends at the corner. For every quadrant, the numbering starts at the center and ends at the corner. Here also, alphabets are used to write for the primary dentition and numbers are used to denote the permanent dentition. Okay. Coming to the next system, that is FDI system. It is a two-digit system proposed by Fédération Dentaire Internationale, accepted and adopted by WHO and International Association of Dental Research. In this system, each quadrant is given specific number, as we know, that is 1, 2, 3 and 4. Each tooth is also given specific number, that is first is the central incisor, 2 for lateral incisor, 3 for the canine, 4 for the first premolar, 5 number given for the second premolar, 6 is for the first molar, 7 is for the second molar and 8 is for the third molar, that is the wisdom tooth. If I want to write for first quadrant lateral incisor, the numbering will be 1, 2. The first number representing the quadrant number and the second is the tooth number. And it cannot be pronounced as 12. It should be pronounced separately as 1, 2. Okay. And it cannot be written as 2, 1 also, because it will become the second quadrant central incisor. Okay. Point to remember here is this numbering system is only for the permanent dentition. For primary dentition, different numbers, quadrant numbers changes here, that is 5, 6, 7 and 8. Tooth numbers remain the same, that is the first central incisor, second lateral incisor, 3 is for the canine, 4 is for the first molar. Hope you remember I told you that premolars are absent in the primary dentition. So 4th is the first molar. 5 is for the second molar. As there will not be any third molar, so no number 6. Okay. Now, here also to write for the first quadrant lateral incisor, the numbering will be 5, 2 and not 1, 2 because 1, 2 is for the permanent dentition, first quadrant, second tooth, that is lateral incisor. Here for primary dentition, the first quadrant is denoted with the number 5. Okay. Hope you understood the concept. If you like the content, please do like and subscribe the channel. Take a very good care of yourself. Thank you.